Maintaining a connection with students and parents is such an important part of being a school nurse. Students need to trust you in order to feel comfortable enough to come talk to you. But schools going remote because of the pandemic severed that connection. In our last half hour, I introduced you to a nurse consultant with the Department of Education and 3 school nurses who spoke of the everyday challenges of their jobs. In part 2 of our conversation, the adjustment of coming back to school.
The impression of the school nurse kind of changed through the pandemic. We had been, helpers, and students would seek us out. And then we kind of had this dark area where they avoided us, and at all costs didn't want to see the school nurse because you were likely to get sent home.
And after holidays and family vacations, did any of your schools pause and say, well, maybe we'll go remote for a week or so before we bring everybody back?
My own children go to a different district, and their district did do the pause. And my own district, we decided not to. It was tough, to have that extra time off because we didn't have a plan for it. We didn't have good daycare for it. There were days where I think I took a day off and my wife took a day off just to split it, so that, as much as it made safety sense, it also made it difficult for planning. And
so you have the parent background on you understanding sort of the frustrations that can come out of this. I'm sure a lot of you had to deal with frustrations, and how did you manage that?
I helped our high school in my district make some of the phone calls about quarantines and things like that, and I certainly heard the frustration in those voices. Sometimes I'd call and it was their 3rd or 4th time they've gotten a call in a few months. Their kids are missing, a month of school in 2 months, and so there's a lot to be said about that situation.
We saw ourselves how often the guidelines changed throughout the last 2 years, and schools scrambling to sort of figure out, okay, are we remote? Are we in class? Do we have masks? Do we not? How much did guidance change for the Department of Education in terms of getting that information out there?
I think one of the biggest challenges was that the federal government didn't let us know that they were going to change something, So when we thought that we had something, because we worked very closely, the Department of Education worked very closely with staff from Maine CDC and trying to make it as easy as possible for schools, understandable as much as we could. On several occasions, we had something planned to go out to schools, and then the federal government would issue some sort of change, and we would have to change. What we thought we were going to say, we can't say anymore.
And it would happen that day.
And it would happen that day.
I'm sure you got a lot of frustrated responses.
Yes, very much. Why is the state making it so difficult for schools, or why is and again, it's the same as the parents and the school nurses too. I think that we are all on the same team, and we're all trying to work our best to the same goal.
What is the hardest part of the job right now, whether it's going remote sometimes or being back in school or figuring out mandates? What is the hardest part?
I think the hardest part is still keeping protocols and safety in the forefront, but also absolutely allowing the freedoms, to be there, but also just recognizing the damage that's done mental health wise, just coordination wise for these kids that are just trying to figure it out. I'm in a 4-5 grade, and it's a very interesting year for them to kind of transition and grow, and they're not as far ahead as you would want them to be to maybe become middle schoolers yet, just because of the time they've missed.
There's so much that has not been done because the pandemic has been all-consuming. Like, a lot of the students haven't had vision or hearing screenings in a couple years, and just catching up with students and meeting them or interacting with them. So it's just a lot of catch up, and a lot of even like filing papers that hasn't happened, just a lot of stuff.
Now, communication goes both ways in schools. So some of our nurses said parents sometimes assume they've heard about what's going on in a student's life from that student or from social media, but that's not always the case. So don't be afraid to call the nurse as a parent. All 4 members of our panel agreed that as the school year wraps up, they are cautiously optimistic for what's to come, but are planning for another increase in COVID numbers as they attempt to start the new year in the fall.